Welcome, everyone, to Season 4 of Fairfield County Talks Housing, a program of the Fairfield County Center for Housing Opportunity. I'm Evonne Klein, founder of Fairfield County Talks Housing. For folks who are new here, this program provides fact-based conversations with the experts and leaders in the fields of housing, affordable housing, and zoning. Today's topic is homelessness in Connecticut. Focus Fairfield County. As homelessness in the nation and in Connecticut continues to rise, we'll hear from the experts on who's homeless and why, how we can prevent and end homelessness, and how the availability of affordable housing will play a role in ending homelessness. A couple of housekeeping items before we begin our conversation today. Live translation is available for today's webinar. To activate the translation function, go to the bottom of your screen, click on the globe, and select your language.
Buenas tardes, este webinario va a ser interpretado al español. Por favor, seleccionen su idioma de preferencia haciendo clic en el globo en la parte inferior de la pantalla y seleccionando español, donde dice interpretación de idiomas, o haciendo clic en los tres puntitos que dicen más si está en un dispositivo móvil o tableta. Esto va a pasar cuando Emma encienda la interpretación. Thank you, Emma. You can turn on interpretation now.
Please submit any questions for our panelists through the Q&A function, and we will try to get to as many questions as possible after our moderated discussion. And I'll be your moderator today. It's my pleasure to welcome our panelists, Steve DiLella, the Director of Individual and Family Support Programs from the Connecticut Department of Housing, Jessica Kubicki, Chief Initiative Officer of the Housing Collective, Carmen, Executive Director at Pacific House, and Katharine Weldy, Senior Director of Supportive Housing with Homes with Hope. And today, we are fortunate to have with us the CEO of the Housing Collective, David Rich, who will set the stage for today's conversation. David has played a leadership role in developing and implementing local, regional, and state campaigns to end homelessness, as well as create and preserve affordable housing in Connecticut since 2005. Over the past 20 years, David has grown the Housing Collective to be the backbone agency for regional, affordable housing and homeless initiatives that collectively mobilizes over 300 social service and community organizations, local, state, and federal government agencies, housing authorities, corporations, and municipalities throughout Connecticut. David, if you would come on camera.
Thank you, Evonne. Good afternoon, and wonderful to see all of you attending today's forum. As Evonne mentioned, we're here to discuss the state of homelessness in Fairfield County, and specifically the direct connection between homelessness and the housing crisis we face throughout our region, the state, and the nation. I'd like to start by taking us back 40 years when we faced a similar homeless crisis and how we as communities came together and created a lasting and meaningful impact on the lives of not only tens of thousands of the unhoused, but the very fabric of the towns and communities we all call home. 40 years ago, homelessness surged for the first time since the Great Depression and became a real critical issue here in Connecticut and across the nation. There were major forces at work, including the deinstitutionalization of the mentally ill, high unemployment rates, the emergence of HIV/AIDS, and deep budget cuts in response to what was then the country's worst recession since the 1930s. Suddenly, here in Fairfield County, we were faced with thousands of our neighbors on the streets with no place to call home. The community response was overwhelming and inspiring. Faith-based and civic organizations and community volunteers came together throughout the county to shelter the unhoused in church and synagogue basements, vestibules, and parish homes. Shelters were created overnight, not just in our cities, but in our suburban towns such as Fairfield, Westport, and Greenwich. Look around you in your communities today, and you find that most of your homeless and social service agencies grew from local faith-based grassroots advocacy and organizing efforts, and a prevailing commitment, community by community, to feed and shelter our most vulnerable neighbors. These community and faith-based agencies evolved over time to become the homeless response system we know today that focus not only on sheltering, but also providing critical social services and finding permanent housing for the unhoused. Through collaboration, pooling resources, and sharing best practices, our homeless system in Fairfield County has been extraordinarily successful in providing shelter and permanent housing. Successes include a year-over-year reduction in the homelessness numbers for over a decade, entering veteran homelessness as we know it throughout the county and across the state, reducing chronic homelessness, those that have been unhoused for over a year, from hundreds to just a handful. Unfortunately, these positive trends marked reversedly in the last 3 years in the aftermath of the pandemic, and now we face a similar crisis today as we did 40 years ago. An already tight rental market became the tightest, most expensive rental housing market in the nation. There have been double-digit home and rental increases for the past 4 years, and there simply is no more room at the inn. Homelessness in Fairfield County alone is up 40% in the last 3 years, with street homelessness up by over 70%. Homeless families are on the streets for the first time in over a decade. But 40 years ago, we came together because we cared for our families and for our communities we hold so dear. And I believe there are 4 compelling reasons why we must act courageously as we did 4 decades ago. For our families, our parents, our grandparents, our kids can simply no longer afford to live in the communities we call home. For our pocketbooks, it is economically unsustainable for our entire county to not have affordable, attainable housing for a majority of our workforce, whether they are teachers, nurses, or retail workers. It is also far more costly to provide emergency services to the unhoused than it is to permanently house them. And for ourselves, we created this crisis by allowing our communities to severely limit the construction of new multifamily housing throughout the county, and we now have a deficit of over 25,000 affordable homes in Fairfield County alone. But we have the means in our hands to solve this crisis locally, community by community, as we did 40 years ago. And lastly, for our communities, I truly believe we all desire to live in communities where school teachers and firefighters and retail workers have a place to call home. And I believe we can together create thriving communities that are diverse and safe and beautiful, with an abundance of housing and high-quality schools. Again, thank you for attending this forum today. And now I turn it back over to Evonne, Klein, and the panelists.
Thank you again, David. And I'd like to invite all the panelists, Steve DiLella, Jessica Kubicki, Carmen Cologne, and Katharine Weldy, please turn on your cameras. Great. Okay, thank you. All right, Steve, the first question is for you. We're aware that homelessness in Connecticut, as well as nationally, continues to increase. Please set the stage for us. How many people in Connecticut are homeless? How many families with children are homeless? So who's homeless? In other words, what are the demographics? Which county has the largest homeless population? And nationally, how do we compare to other states? And if you could touch on, this is a mouthful, right? What's the cost of homelessness per individual and family? So I think you may have a slide on this. So to help answer and guide these questions for our audience.
Great. Yes. Thank you, Evonne. Emma, if you could pop up the slide so everybody can see, that will give an answer to a lot of those questions, Evonne. So yes, homelessness, obviously, as David said in his remarks, is something that really started to really rear its head again back in the 1980s and has gone through ups and downs. We really were making great progress before the pandemic, but after the pandemic, with the cost of housing, we started to see increases both here in Connecticut as well as across across the country. There are multiple different ways that you can look at trying to define the number of homeless. You have two charts here. One on the right is something that HUD requires, which is the Federal Department of Housing and Urban Development. They require each year for each entity called a continuum of care that receives federal funding to make a count of all homeless households within their jurisdiction. So as you can see there, those numbers look kind of stable over the course of time, at least from the past 5 years, but you will notice on that green line that the trend was to continue to decrease until COVID happened. You'll see some wider swings on the national level, and you can look at some of our peer states, whether it's Virginia, Illinois, Massachusetts, that have that show very, very similar trends, but just different numbers. I think here in Connecticut, we're quite lucky to have a strong investment from state government that helps provide additional services and housing resources for the homeless households, which leads to us being a little bit have lower numbers than some of our peer states. Another way to really look at homelessness is to look at the number of people that are on our by name list, which is just a list of individuals that have come and families that have come into our system looking for housing. So currently there are 4,339 households that are on that by name list across the state. And then within that, it is broken down by families as well as youth. So you can see there that 661 families across the state are homeless, as well as 364 youth. Some of the things that we've seen during the pandemic is an increase in those folks who are considered elderly, in this case 60 and over, entering into the homeless service system. And I think a lot of that is just fact driven by the rapid increasing of cost of housing, whereas the increases in incomes, especially fixed incomes, has not kept pace, therefore leading to higher numbers of elderly trying to seek our services. Now, in terms of your ethnic breakdown, the people of color are widely overrepresented in the homeless numbers, even though the white population technically has more by flat out numbers. It's relatively close. Like in Connecticut, a little bit over 1,000 white individuals are homeless, according to the point in time count, and a little over 1,000 as well who identify as Black or African American. But clearly that represents a strong correlation that people of color are much highly represented in the homeless population, because in the overall population, they make up a smaller percentage. And then clearly, like I stated, for the elderly population, the reason why we're seeing such increases in homelessness is just that mismatch between income and housing costs. But clearly, there are other reasons why households enter into homelessness, whether it's mental health issues, physical health issues, substance abuse as well. And now in terms of some of the costs that we have shown, it costs about $11,500 per person to shelter somebody in the state of Connecticut. So as our length of stay has gone up, you can take a look at a family of four. That would be nearly $46,000 just to keep a household in shelter. And that doesn't include all the auxiliary costs, such as medical care and other traumas that may happen during a shelter stay, which would lead to a vastly higher cost of keeping somebody homeless over the course of a year. Now, if we simply provided a rent subsidy with some services, we're looking at the rent subsidy for a household of four statewide about $15,000 a year, and you add in state services, and you're talking about another $10,000. So it's dramatically cheaper to actually house people with some case management as opposed to keeping them homeless. So I think that is sort of the current state of where we are on homelessness. I think I hit on all of your questions there, Evonne. And if not, just please ask a question. I'll be happy to do that after the other presenters go.
Great. All right. Thank you so much, Steve. Jessica, your focus is Fairfield County. So again, we're going to set the stage. Steve was helpful in setting the stage for the state of Connecticut. So if you would please set the stage for us with a focus on Fairfield County. So how many people in Fairfield County are homeless? How many families with children are homeless? Who is homeless? In other words, again, what are the demographics? And which town has the largest population of homelessness in Fairfield County? So I'll let you go. And I think you also have a slide or two for us.
I do, yeah. So Emma, if you don't mind pulling that up. And actually, Steve really set the stage very nicely for me, so thank you. You're gonna notice that a couple of the visuals look very similar. I actually took the Fairfield County point in time count that you're gonna see on the left. We saw a 19% increase in our total people count, so all people, and I'll break down the populations in a second, from last year to this year. The other thing that you're looking at is of our total inflow that comes in annually. So I did fiscal year 2023 to 2024. Bridgeport sees about 57% of that inflow. And then you're looking at Stamford coming in next at 18%, Danbury at 15%, and Norwalk at 11%. So we do see a significant portion of our homeless through our inflow in the greater Bridgeport community. I do want to reference when I say greater Bridgeport, that does encompass all of the smaller towns around. So that's reflective of all of them. So greater Norwalk, greater Stamford, right? So we're encompassing all towns. Emma, can you go to the next one? Please, thank you. So this is real time. The total number of unsheltered homeless in Fairfield County as of yesterday afternoon when I put this together. So there are a total of 94 men, 40 women, and we actually currently have 23 families. And with that, there are 36 children under the age of 18 that are literally homeless. So that means that they are in a car, they are in encampments, they are at the bus or train stations, and you'll also see the breakdown of each sub-community. Obviously, as reflective in the slide before, Bridgeport does hold a large number, but each of our sub-communities does have a large number of unsheltered. The other thing to note is there is also a large number of people who are unsheltered and are not interested in emergency shelter. So we also have an additional 109 clients. Those are all individuals. So every family that comes into our system is interested in emergency shelter, but sometimes for our individuals, they might not be. We'll still work on, obviously, housing plans and working on trying to alleviate their immediate crisis. But we have a lot of people waiting for shelter at any given time. Can you go to the next one, Emma, please? So just to give you an idea, oh, and I'm sorry that the yellow isn't showing up, but on average, it is showing the average length of time. So the green and the like pinkish color, that is men and women. Family is yellow, and that's 60 days. So on average, that's the day from the time that they are added to our shelter waitlist, which normally is the date that they're engaging with our homeless response system, to the day that they are offered a shelter bed and enrolled in there. We're looking at 2 months. And so just to give you also a breakdown, about 10%, it's a little less, it's like 9.5, I think, percent of those that are on the shelter wait list are our youth, and that's 18 to 24. We actually have seen a significant surge in our elderly. I know David referenced that before. We actually now have more than 25% of those on our shelter wait list that are over 62. And recently, we've had people in their 80s accessing emergency shelter. So hopefully in future conversations, I'm going to dive into that just a tad bit more. But I'm hoping that you can leave with Fairfield County is certainly seeing not only the trends happening nationally and statewide, but I think almost in a larger magnitude, just due to the sheer discrepancy between the rents and the significant increase in rents and the lack of matching increase in income. Thanks, Evonne.
Thank you, Jess. Carmen, please talk about Pacific House and what Pacific House offers to people who are facing homelessness. And Pacific House is located in Stamford, Connecticut.
Yes, good afternoon, everyone. Evonne, thank you for having me here. Pacific House is a nonprofit located in the city of Stanford. Pacific House offers emergency shelter for up to 67 men, and we also offer permanent supportive housing for single adults and also for families. We're really thrilled to be actually the home to the hub, which is the entry point that the homeless population uses when in need of services. And I'll describe the hub a little bit. So our hub, many people, when they are experiencing homelessness, contact 211. And I do want everyone to know that 211 is a great system, but it's not the only system. When folks are experiencing homelessness, they can come directly to our hub. And there they will access services. And what happens at the hub is that they will meet with our navigators, which are social workers, that would help the population that we serve be able to access whatever services they're in need of. For instance, one of our biggest things that we offer is diversion. And what we mean by diversion is that we get to the root causes of why an individual or a family is homeless. A family or an individual might have some resources that they might not have been able to tap into. For instance, they might have an aunt, a family member that will take them in if only they can provide maybe an additional 1 month rent, and we can be able to assist with that. We can give them some resources to help their family member with the rental assistance. An individual or a family might be in need of just busing to get them to potentially another state where they have resources, where they have family members, and we can provide that train ticket. We can do mediation with landlords. We can take care of all of that when an individual or family comes into shelter. Of course, as Jessica stated, there are people that do not want shelter, but if we do have room at the inn, as David stated earlier, where often we don't, we will take that individual or that family in. We're also really excited about the services that Pacific House provides when it comes to outreach. We'll hear a little bit later on in regards to tents and people that are living in tents or under the bridges. Well, one of the things that our outreach workers do is that they go to these tents, they go under the bridges, they go to those cars where people are just camping out, and they do offer the services. We do an intake right on site wherever a person may be to make sure that that individual or family can feel connected to someone that's going to help them, and not just stating that we're going to bring them into a shelter, but that we're going to provide long-term services to make sure that we are bringing people into permanent housing, places that they're able to call homes. Pacific House has close to 200 units of permanent supportive housing. We're in the process of building another over 60 units of permanent supportive housing. All these units have case management services where we make sure that our case managers help individuals and families maintain their housing. That is key. Helping individuals and families maintain their housing is key. Many of the individuals that we serve are coming off the streets. Therefore, when they're coming first into housing, they're afraid. They're afraid that when is this great thing that I'm calling home going to just disappear from me? Well, we make sure that through the process of our caseworkers working with these individuals, that we're providing those services to make sure that individuals and families do not become homeless all over again. Thank you.
Thank you, Carmen. Katharine, please talk about Homes with Hope, which is located in Westport, Connecticut, and what Homes with Hope offers to people facing homelessness. Homes with Hope is located, Westport's a suburb, and I believe this is the only homeless shelter in a suburb of Fairfield County. So if you could also share insights on how your organization is received in Westport, and also a sense of what other communities may be able to learn from Westport's example.
Thank you so much, Evonne, for having me here today. It's a pleasure. Homes with Hope is a Westport-based organization dedicated to preventing and ending homelessness in Fairfield County. On average, every year, we serve over 1,200 people, and on average last year, we served more than that due to the huge need here in Fairfield County. Throughout our array of services, we do prevention, shelter, rapid rehousing, and permanent supportive housing, as well as we have an after-school academic program and a mentoring program. We provide services to people throughout Fairfield County. Homes with Hope is located in Westport, which is a very suburban town. We have learned that only 2 other affluent towns in America have a homeless shelter in their downtown district. We are very proud of this, and the town of Westport is extremely supportive to Homes with Hope in everything to do with affordable housing. For example, the town of Westport applied for and were successful recipients of a diversion grant from the Department of Housing through HUD to provide diversion services through small cities with the support of the Housing Collective to support agencies throughout Fairfield County. This is the first time this was ever done in Connecticut and is a model worth following. Also, the town of Westport donates the Gillespie Center, which is our homeless shelter housing 19 homeless men and women, and Project Return, which is a single room occupancy for 6 homeless 18 to 20-year-old young women. And also the Lynx Warla House is currently being used as a temporary homeless shelter and has traditionally been used as permanent supportive housing in Westport. These are all examples of how even a small town can be part of the solution to end homelessness by providing in-kind property and land support. We get a lot of support in Westport from the faith-based communities, as well as other clubs and social groups. Homes with Hope is always the agency that is contacted when someone turns up in Westport that is dealing with housing and food insecurity. We're always the agency that is contacted by the local community. Thank you so much.
Thank you, Katharine. Jess, oh, and I just want to take this time to remind folks again, if you have any questions for our panelists, please put them in the Q&A function, and we will save some time to get to your audience questions. So Jess, the next question is for you. There are a number of misconceptions about people who are homeless, such as people choose to be homeless. They're lazy. They don't want to work. Can you share your thoughts on the narrative around homelessness and how people's stories are told and by whom?
Yeah, absolutely. And I'm so happy that you asked this question, Evonne, because we get this a lot. And I think this is probably one of the biggest misconceptions around homelessness at this point in the culture that we're living in. Just to give you some context, so annually, we get about 2,600 people, a little bit more, who come through our doors. Some are brand new and have never been in a housing crisis before. Others might be circling back another time, and everything in between. Of those, 48% of them have income. So the notion that every person that comes in is lazy and doesn't work is just not factually there. We have almost 50% that do have income. And the interesting thing is, of all of those that have income, more than half, so 55%, have earned income. So they work. So yes, we definitely have a lot of people that have state benefits and limited income. They are incapable of, accessing and working a full-time job for whatever reason. But majority of our people, they work. And unfortunately, we've gone to a place where one individual could work 2 full-time jobs at minimum wage, and they cannot afford an apartment in Fairfield County. Half of our staff are in that exact position. And so we've got staff who are working with the population and doing this amazing work day in and day out, and they're commuting over an hour because they live somewhere that is cheaper than Fairfield County. We did a recent study of the staff within Western Connecticut, and 22% of all of our staff reported that they have struggled to pay bills, they've lost their housing, or is at risk of losing housing in the last 6 months. It is no longer the people that are lazy and using drugs and this and that. It is people who cannot afford to live in the community anymore. And that's who we're seeing. We're seeing, as I mentioned, the massive increase of seniors. We're finding 80-year-olds that have never been in a housing crisis before, but their spouse died and they can't afford a mortgage anymore. Or, their utilities or something happened and they no longer can maintain their own and they foreclosed or they lost their rent. And we've got landlords that are coming in and increasing rents really significantly. That's the population that we're seeing now that's coming through our doors. Sorry, the very last thing, I don't want to lose sight of the number of families too. Pre-pandemic, we didn't have unsheltered families. That wasn't a thing, right? So if you had one, it was like immediate. If you remember my slide a few minutes ago, we have 20+ families that are unsheltered in Fairfield County. Not doubled up. I'm not even referring to the ones that are in 1-bedroom apartments and you've got 8 people in there. I'm referring to the actual families that are living in their cars because single mom with multiple children, and it's impossible to work or impossible to afford, with the income that they have. And so that has been the biggest significant change that we've seen over the last couple of years.
Great. Thank you for painting that picture for us. Steve, let's talk about encampments. We hear a lot, we hear about them every so often in the news. We hear about tent cities. So talk to us about encampments. What are they? Why do they exist? And how do they come to exist?
Sure. Encampments are, outdoor places where people, homeless individuals and households kind of come together and live almost in a small community, which is quite interesting. They are located everywhere that there is homelessness. So whether it is in a city, in some underutilized space, or whether it is more in the suburban rural areas out in the woods, this is where people kind of go where they can find a place that they may feel comfortable in an outside setting. Usually you'll see them create some sort of shelter, whether it's a tent or some other kind of lean-to. And oftentimes they have other individuals living there as separate households, and they kind of work together to maintain safety and security. We've seen encampments as small as 2 to 3, all the way up to 10, 15 to 20 individuals or households. So this is something that really has started to pop up as the number of homeless have increased, because we do have a static number of shelter beds throughout the state. So without additional shelter beds, if folks don't have a place to go, this is often what is sort of their choice. And what we've seen across the state is what the state has really tried to do is increase our homeless outreach efforts to be able to hire workers to go and find these encampments and try to engage them to bring them into services, whether it is through shelter or whether it is just engagement to get them onto our by name list that actually have some housing resources. So it is something that is there, and it's also something you see most often in the papers where municipalities decide that they're going to clear encampments. So, which is basically take them down. So we've really tried to work with, our state partners and our municipal partners and trying to figure out before any of that happens, these people are connected to some level of services so that we can follow them and hopefully get them on a pathway to housing.
Great. Thank you, Steve. Carmen and Katharine, I'm going to go back to you. What are your greatest challenges as direct service providers?
Sure, I can begin with that. We've been saying it, right? The greatest challenge is being able to find homes for these individuals that are coming to us, and affordable homes. Can we find homes? Yeah, for the most part, right? But affordable homes, places that our families and individuals can go to that are safe, that they can afford. So the lack of being able to have jobs that pay them enough money to be able to live in Fairfield County is a huge problem. Jessica alluded to the fact that half of her staff team right, is really housing insecure. They're driving over an hour to be able to access homes. So being able to access affordable housing here in Fairfield County is one of the biggest challenges. And also, I mean, we are talking about, you know, the myths behind who's homeless, right? So a huge challenge is that folks, when we're developing housing here at Pacific House as a housing developer, one of the things, and when I was in Bridgeport, one of the things that we're always having to go around is really proving to people that these are just human beings that really need a roof over their head, that it can just be me, Jessica, you, anybody else, that we need to develop housing for all our folks to be able to have places to call home. So, you know, the NIMBY piece is still there, very alive in our community. So that's a huge challenge for us, being able to really get through to people that we need everyone to help us being able to develop housing for the population, being able to find apartments for them, and again, affordable. I couldn't say enough. This increase in these rents is just insane. I have never seen anything like this. When you have 2-bedroom units right down the street from me here in the city of Stamford, going for over $5,000 a month, a 3-bedroom unit is $8,000 a month. Who can afford to pay that?
And I echo Carmen's sentiments as well. I think the biggest challenge right now is the lack and price of housing. For example, recently with the grant from the Department of Housing, Homes with Hope took over a building at 122 Wilton Road. We have 19 individual and family units of affordable housing. Firsthand, I have witnessed, you know, families moving in. Many of them are so grateful to just have a roof over their head that they can afford. And despite many of them working 2 jobs, just to bring things into proportion in Fairfield County, a person would have to earn $42.50 an hour or more to afford a studio apartment. The working poor that were moving into 122 Wilton Road are earning $16 to $20 an hour. And I feel like, you know, without this affordable housing building, they would not be able to live in Fairfield County.
Carmen and Katharine, don't go away. I want to follow up on a couple of points. And I think one of the points I think people are hearing in our audience is that, number one, for those of us who are fortunate to have a home and be stably in our home and be able to afford our home, we may not understand that not having a home is a crisis of someone's lifetime. And I think that sense of urgency, you know, just continues to need to be underscored. So both of your organizations provide housing for people of low incomes. And as you both have stated, you've developed housing in each of your respective communities. So Carmen, I think I'm going to go to you with this question. You've been before planning and zoning commissions, in zoning boards. So what are your greatest challenges in working with, you know, the planning and zoning boards and commissions? And of course, Katharine, feel free to jump in, or any of our other panelists.
Well, I answer that question by beginning to say that it really, it's the biggest challenge is that it all depends on your zoning committee, those individuals that are sitting there. It all depends also on, which is know your audience, right? So when I am going in front of that zoning board, I better make sure that I know every single one of them, that I would have had to have done my homework with them and educate them on what exactly is it that we're trying to create. That doesn't mean that I'm going to get thumbs up. That only means that now the challenge might be, the burden might be a little less, because now they're sort of saying, yeah, we might go and we might be okay with this project. Meanwhile, these are the same individuals that are asking us, what are you going to do about all these homeless people that are on our streets? Well, I'm coming to you. I have this great project, and you're making it very, very difficult for us to be able to get this project off the ground. It happens, every single municipality is different. Every single administration is different. And I think that from my experience, my biggest challenge has really been to making sure that we have administrations that understand what affordable housing is. Many times when we're going in front of these boards, they're not even listening to the fact and looking at what they're supposed to look at, right? Which is the plans of, is the area zone for this? No. They're immediately just thinking about who are the people that are going to come to live in these apartments. And if they know that, for instance, is Carmen Cologne, who has been working with the homeless population for the past 35 years, immediately they are thinking that I am bringing individuals into this new development that are not the homeless population as we know it, but individuals that might be that persona non grata in their neighborhoods. So immediately they go into that. So the challenges are really helping them understand, educating those individuals that sit on our zoning and commissions, because they actually go into those slots and they really don't understand what we're trying to do and what we're bringing to them. The educational piece with them, really, we really have to do a lot more of that. But again, then it takes away from what we do every day and being able to provide the services and everything we do for the population, because now we have to go in there and educate individuals that basically a lot of them don't want to understand what we're trying to do when we're building housing for all.
If anyone would like to add on to that, Katharine, what should decision makers do? I mean, again, you've all had your successes in your respective communities, but what should land use decision makers, from your point of view, know about housing people who are of low and low income?
It is important to house people of low income for many reasons, such as the fact that you're supporting essential workers. Essential workers such as store associates and service industry professionals, that they're the backbones of these communities, yet many struggle to find affordable housing near their workplaces. Here at Homes with Hope, we recently had a ribbon cutting at 122 Wilton Road in Westport of 19 affordable housing units. Homes with Hope is addressing a critical need and enriching the social and economic fabric of our community. Affordable housing units like 122 Wilton Road are so important because they broaden the cultural landscape and fostering economic diversity, broadening the perspectives and experiences represented in communities. This inclusivity strengthens the cultural richness in towns like Westport, creating more vibrant and dynamic places to live. Affordable housing helps with the 830G mandate by proactively addressing affordable housing needs. Westport is complying with Connecticut's 830G mandate. This enables the town to develop sustainable housing strategies while working towards an 830G moratorium, positioning Westport for future grants that can fund community development and infrastructure. Affordable housing invests in Westport's future. By providing affordable living options, it promotes economic resilience, it fosters a more equitable society, and it ensures that everyone can thrive in their community.
Great, thank you for that perspective. So let's go to some audience questions here. So anyone on the panel can jump in and answer these questions. So the first one is, how can we help those who can't go to work because childcare is not available or is, well, I should say, and is too expensive? Who would like to take that first?
I can.
Yeah, go
Oh,
ahead, Carmen. No, please go ahead, please. Okay, I was gonna say, I think the biggest thing, and I'm assuming Carmen's gonna say the same thing, is Care for Kids. It is readily available, and actually there is a priority for the homeless population. So making sure that that is accessed for every eligible family. That being said, I'm gonna put the asterisk that the actual daycare may be the hard part. And in finding those locations, I will say a lot of our organizations and many of our partner organizations offer childcare, and they do prioritize the homeless population as well. Did I speak everything for you? Sorry, Carmen.
Okay, I think everyone is going to want to weigh in on this one. What things do the panelists think would help prevent homelessness? Realistic or not? Who would like to start?
Sure, I'll take a stab at that. And I think one of the things that we've certainly been working on here in Connecticut is really creating a continuum of services throughout a homeless experience. When we really first started this, like David said, back 40 years ago, it really was just shelter, and then then transitional housing came along, and then permanent supportive housing. But we know that those were very, very good resources, but maybe not exactly what everybody needs. So it's really trying to understand the people that are experiencing homelessness and really what exactly do they need to get them back into housing as quick as possible, whether it is a security deposit or a link to employment or a permanent supportive housing voucher because they need that permanent subsidy as well as some permanent services. So really creating that, and clearly from that perspective, I think our partners have done such a great job at lobbying at the state and national level, really to show the effects of having these type of resources and how they can be implemented and effective if fully funded.
I just want to feed off of one thing. The Department of Housing put together a homeless prevention program during COVID with excess COVID dollars, and we saw that success. And I just want to give massive kudos because we need that forever. Unfortunately, that was temporary time limited funding. But we actually found that almost 60% of all the households that receive mediation, we had a contract through Quinnipiac University, did not come through the can. And so that worked, right? And so I think there's a level of service that we can invest in, and unfortunately that's a state investment, not a federal investment, that could really tie to all of the continuum that Steve has talked about. But we had it and it worked, and I think it's just finding where we can continue that investment.
Great, thank you. What's one reform that you think would be most impactful in increasing affordable housing stock, either locally or on the state level? Just one reform. Who wants to jump in? Carmen.
I think inclusionary zoning, enforcing inclusionary zoning definitely would benefit all of us. I really think we need to look at these rents and really create a rental cap. And I know that is not politically correct when you start making those statements, but at some point we really need to get into some rental caps. These rents are just astronomical, and I just don't see a way out.
Okay, thank you, Carmen.
I'm sorry, I actually have one more thing to add to that. And if I don't add this, it's going to kill me. So the land use trust funds that go into municipalities because developers choose not to include X amount of units in their developments that are affordable, and rather pay that fine, or rather pay off and just dump that money into this land use. To me, it really bothers me. And the reason why it really bothers me, and we need to do something about that, is because for-profit developers can develop housing a lot faster than I can as a nonprofit developer using government funds. Therefore, those 2 units, even if it's 2 units, I can utilize them immediately, almost immediately, rather than waiting 2 or 3 years by the time I develop my maybe 19 units, right? So I can utilize all those units faster. So I really don't think that we should let them off the hook that easily by paying, X amount of dollars. Instead, I want the unit, not the money.
Can I also just add, because Carmen, that's so important. And I think also, I just want to make the connection between homelessness and housing. For a long time, they've been very separated, right? You kind of looked at homelessness and then you looked at housing and development, right? The reality is, though, they are so enmeshed at this point, we can't do one without the other. And the reason I say that is when we can't find affordable housing, or we have people who actually have financial assistance and are screened out of every unit that there is. This is why, and I think Steve mentioned it at the beginning, this is why our shelter beds are awful. This is why the length of time in shelter is so long, is because we can't get them out. And then as a result, you see more people unsheltered and we see more inflow and people are losing, and it's this vicious continuous cycle. And I think really the way to address that is what Carmen's referring to around just a natural every development. There's a million developments going around. I'm sure you could turn around right now and there's a development going up next to you, right? None of those units are for us. None of those units are affordable. When we say affordable, at least for our population, it's deeply affordable. We're looking at 30% area median income or below. Yes, there's a cohort that needs the 50, there's a cohort that needs the 80. I don't want to discredit that. But I think for us, we are getting slowly screened out more and more from these units, whether it's affordability or whether it's background and everything else. And that's become incredibly challenging for us.
But I think the easiest way to put that, Jessica, is the solution to homelessness is housing.
Yes. Yes.
That's simple.
There's been consideration to prioritizing shelter for families that are DCF involved, or parents that are requesting foster care placement for their children. So are parents requesting foster care placement for their children due to unstable or lack of safe housing? Steve, I think I'm going to direct this to you, Steve. Are you seeing that on a state level?
I have not really seen that on a state level. There may be a case here or there. But in and of itself, being homeless should not necessarily trigger any DCF involvement. Usually it's the things that are associated with homelessness that may trigger that, whether it's, substance abuse, abuse, neglect kind of a thing. So there are plenty of families that are within the homeless service system in which their parents, of the heads of house of the parents of the kids love and take very good care of their children. And it's just the fact that they don't have the ability to afford a rental unit. So we really have not seen this massive DCF push for that, and nor would I suggest that we do so, because I think our goal is just to house folks as they are, as quickly as possible.
Thank you. I think this is important for our audience. So can we refer someone from one county to another? So if I'm homeless in New Haven, what happens if there aren't any shelter beds? I'm just making this up, in New Haven, and there are shelter beds maybe in Norwalk. Mm-hmm. What happens? Jess or Steve, do you want to?
Sure, I'll take it a little quick, and then Jess, you can look at it from your perspective. Sure. So one of the things that DOH was able to do was we were able to hire, thanks, Evonne, a couple of CAN managers, coordinate access managers, so that's staff that work with me really to oversee the CAN. So in an instance like that, where you'll see like a homeless family with children, not have space in a particular community, they generally try to work out to their partners and see if they can make any other space work. So we do try to shuffle the deck, because our goal is not to have any children outside at any given time.
Yeah, I think just to piggyback, the 7 CANs across the state of Connecticut, we all work very, very closely. And so I think if there are ever unsheltered families or those in need that are open to relocating. So I do just want to preface that there are a lot that for many reasons cannot relocate. But if they are, we will collaborate with other communities and ideally try to have that be temporary. So for example, if that family in New Haven, if we had space, but they want to be housed in New Haven, we obviously will coordinate that. And if there's a vacancy that opens up there, we'll then transition them back over. It's all about client choice and kind of where they wanna, where their roots and their community is.
Great, thank you. What role, and I don't want to spend a lot of time on this piece, but again, it is important for folks to know, what role does public transportation have in solving the unaffordability of housing? Right, someone I think mentioned transit-oriented development here today, and does more need to be done in this regard? Any comments about transportation?
Sure. We work closely with the Department of Transportation, and specifically here in Stamford, we are on a call every 2 weeks with the Department of Transportation. One of the things that happens is that our folks do use the railroads, right? The railways. So they are on trains, they are there, and we want to make sure that we are working together. For instance, please do not, just kick our folks out into the streets, especially in the cold weather. Call us up. We're going to do something about it. We're going to make sure that we're working with them. Here in the city of Stamford, actually, the Department of Transportation gave us an office there at the train station to work with our outreach workers and work with folks, ensuring that we can be able to provide the services that we need. Also, making sure that we are working locally with the bus lines. A lot of our folks to get to work, they are using the buses. This is the way that they get to work. So ensuring that we do have a great partnership with them to try to see if we can get lower rates on bus passes so our folks can be able to get to work would be phenomenal. So we do have those relationships. So we do work hand in hand with the Department of Transportation.
Great, thank you for that. There is a comment more, I think, than a question here about partnering, that I guess, that folks discuss a plan to partner with senior housing in Fairfield County and to create a universal application for seniors. Currently, seniors need to apply to each building individually, and the wait times are 1 to 2 years long. We know that the wait times are very long to get in any kind of deed restricted affordable housing. So I think that is a comment to take forward with you all.
So if I can just, one of the things that I'm most proud of about opening doors here in Fairfield County is that we don't do anything in silos. We create partnerships with everyone. And we have worked really closely with local housing authorities because they do manage a lot of your senior housing complexes, and to ensuring, what can we do? What can we do to be able to assist? As this growing population of seniors, continues to increase, one of the things that we need to do is we need to work closer with the Department of the Office of Aging. To make sure that they also have the resources that they need, and that we're not getting all of these folks coming to our end because there are pieces there that we don't know how to provide certain services to seniors, different things that they may need other than housing.
Great, thank you for that. I just want to say before we end today that if folks are experiencing homelessness, to call 211. And you will be on your way to getting help with finding shelter and housing. And as we heard today, certainly we have challenges. So again, I would like to thank our panelists, our audience, our sponsor, the Housing Collective, and all of our partners, the Partnership for Strong Communities, Fairfield County's Community Foundation, and Local Initiative Support Corporation, as we all work together to deliver safe, equitable, affordable housing solutions for families and individuals across Connecticut. Please join us on November 13th for another Brown Bag Lunch webinar, not for renters only. So excited about today's conversation. Again, thank you all for your good work. and for your good thoughts on this crisis in Connecticut. And we look forward to seeing all of you again in November. Thank you and have a great day.